Morena whānau, te tuatahi ka mihi ki Kingi tu Heitia, e noho ana I raro I te manaakitanga o tōna māma te kāhui arikia te Atairangi Kāhu, anō hoki ki te hau kāinga, Ngāti Wairere, Ngāti Mahanga hoki, he piko he taniwha, he piko he taniwha, waikato taniwharau. So yeah, Chair, good morning everyone. Ko Jora Waiti tōku ingoa, huri ahau no Ngāti Piki ao, te arawa waka, tā toku māma ka whakapapa hau ki te rāroa, te tai tokerau, nā reira, kia ora tātou. So I'm just speaking today as a representative of our research team that's been working alongside Whai Claire in the STI project. The title is Name the Website Dr Steez. The name Dr Steez came about from one of our participants who was pretty much saying, well, if you want to develop resources or a website for youth, then that website's got to reflect their language. Some of you from the top part of that demographic graph were probably wondering what the hell does Steez mean. From my understanding, it comes from the word style or stylies, and it's been our youth of today have extended it out to mean the word Steez. So Dr Styles, I suppose, is another way to look at it. I'll talk about the rest of our team throughout the kōrero. Flip that. So Whai Claire's already spoken about how STI are going about developing a national STI website, and a website that works for both health professionals, sexual health providers, as well as the general public. We all know the discourse around STI rates in New Zealand. Some of our regional rates here are higher than national rates in Australia and UK, and Māori and Pacific are at greater risk of STIs, and I put that down to socio-economic factors. But I don't want to dwell on that too much. It was awesome to hear Dr Tahu's kōrero yesterday around the low levels of unwanted pregnancies, which I think came to a surprise to a lot of us, and I blame that on mainstream media. Thankfully, Whai Claire's already spoken about the first stage of the collaboration. I'm not totally sure if VC is still on board, Robert and his team, but I understand he has done quite a lot of work around website, Facebook stuff with our Pacifica cousins. And Te Puawai Tapu, we were charged with focusing on the Māori component of the STI website. So we went and checked out the evidence in the literature, and we found kind of three at-risk groups: young Māori up to 25, school-age kids 12 to 18, and pregnant Māori women under 25. And you could probably argue that their partners as well fall into that as well. But we condensed that group down to 16 to 20-year-olds. We dropped off the under 16s because we would have had to get ethics to interview them, and we only had a short 3 to 4 month period to do this project, so we had to leave them out. And we cut the 20 and overs off because we thought 16-year-olds might, in a focus group situation, 16-year-olds might feel uncomfortable sharing their feelings with an old school 25-year-old like me. So to help get some good info for Claire and her team, we came up with 2 research questions. The first one, we wanted to find out how much time rangatahi spend on the internet, through what mediums do they access it, smartphones, iPads, etc., and what type of websites they go to, and why to those websites. And then we also wanted to figure out what makes specific websites appealing to them. Why do they keep going back to those same ones, and what makes them easy to navigate and user-friendly for our young folk. Now, to help us answer those questions, we were fortunate enough to collaborate and receive assistance from two youth health providers, Justina and her team here in Hamilton, Tahurea Rangatahi, and we also teamed up with Bernie up at Youth Space Whangarei. The managing, being able to draw on these networks, these two providers, was imperative to us as a whole, being able to fulfil the objectives of the project in such a short time frame and with minimal funds. It would have been crazy to suggest that Te Pō Waitapu alone could have gone out and engaged with these communities and get the information that was required for the website. So yeah, we were lucky to team up with those two rōpū. So again, with the help of those two providers, we ran 2 focus groups in each setting, 2 here in Hamilton, 2 up in Whangarei. Our first ones were with, we had one with young Maori, the 16 to 20-year-olds, and then we also had one with health promoters from that region. It was important, we thought it was important to get the thoughts and ideas from the health promoters, because they're the ones actually on the ground every day, kanohi ki te kanohi with these rangatahi, and we wanted to get their perspectives as well. And yeah, it would have been a waste of time, us as Te Pō Waitapu, thinking we knew what these kids wanted. So that was the reason behind getting youth health promoters in there as well. They went for 1 or 2 hours, depending on how much they like to talk, and we provided $50 koha for each participant, just for taking the time out of their day. Health promoters, health workers are jam-packed during their day anyway, but yet they were willing to come along and spare 1 or 2 hours with us. And kids were managed to get away from their phone for 1 or 2 hours. So it's just a little koha to them. And our interview schedule consisted of 3 parts. Questions around the internet usage and behaviours. We also wanted to garner some information around their knowledge of STIs, what they did know and what they didn't know. That would help us decide what needs to go on the website. And we also threw up some dummy Stife screenshots. Whai Claire had a couple of those up. And we also, Itchy Bernie Bits is an awesome site that's already in existence, developed by Jane Morgan. And we threw that up as well and got them to play around to see how they navigated through that and what they thought of that as a STI website. And then we analysed the transcripts. No, we transcribed it all, focus groups, sent it back to our health providers to see if they were happy with it, if there needed to be any changes, if we recorded things wrong and stuff like that, and got it back from them. So we got the okay. Went ahead with the analysis, just drew out recurrent themes, reoccurring ideas, those sort of things, and put them under each of those interview schedules. And underpinning the whole research project was a kaupapa Māori approach. Kaupapa Māori is it's kind of hard to define, but it's where you do mahi or research that's underpinned by Māori tikanga. We're not instead of coming from a Western discourse of research and work, we came from a Māori discourse, and provides validity and legitimacy to our Māori way of knowing, our Māori knowledge systems. So that underpinned the whole process. Findings. I'm just going to run through these quickly because we'd planned to write up our report and send it to the Stife board before we come here, so I could talk about this stuff. But we're only like 3 or 4 days away from sending it off. We couldn't get it back, couldn't get the okay from them. But I'm going to throw it up anyway. And so you're going to see the slide, but you're not. So these are just initial. That's all I'll say. These are initial findings from our rangatahi and our health promoters. And a lot of the kōrero that came from our rangatahi were pretty much reflected in the kōrero from our health promoters. Firstly, you all know our young folk are high internet users. You only have to go into a family living room and everyone's on there, even old mum and dad are going pretty hard on their phones. Or public transport, kids are like that, they can't even have a yarn because they're like, same here. And The main sites they're going to are obvious social media. Facebook was probably number one, YouTube, and then they go to Google as well if they're wanting information on various stuff. The knowledge around, rangatahi knowledge of STI seemed to vary, varied by school and by whether they had a school nurse, I think, too. We found out that some their teachers would take them into like a family planning clinic or sexual health clinic and walk them through the processes, whereas some were exposed to just like old school OHPs, blackboard stuff. So that could be a reason why the knowledge of STIs varies. We asked them all if you wanted to find out some more info on STIs, who do you go hit up? And number one was friends, and also if they had a school nurse, that was another source, and health providers, their youth health providers or sexual health clinics, especially those that are that spend a lot of time at their youth providers as well. You'll notice whānau's not really in there. A lot of them were a bit too ashamed to whakamara, talk to mum and dad. Problem with the friends thing is sometimes your friends aren't tohunga, well, they're not experts in that area, so getting sort of out there messages. There's still a whole lot of myths surrounding STIs. A lot of the kids still thought you get a big rod slammed up your koito and things like that. They still think, myths like that. Some of them come from their friends, some of them come from their uncle. Oh, my uncle said, you get this, you get that, so I'm not going there to get tested, things like that. Now, in regards to the text on the websites, kids don't want to read paragraphs of stuff. These ones just want to see bulletproofs, boom, boom, boom. Short, sharp information. They don't want to know the background information to a STI. They want to know what I've got, how do I get tested, and how do I get it fixed. Not the pathology and all of that jazz. And of course, in relation to Facebook and YouTube, that kids these days, they not so much into reading, they rather see videos and audio-visual material, they'd rather see pictures. And so a good example would be the I Love Your Condom site. If you just come across that recently, they've got a little short clip there of a person going through the clinic and what's involved there. It's those sort of things that the kids want to see, what's involved with testing, that sort of stuff, instead of reading it.
5 minutes, Jordan.
Yep. And like I was saying before, they don't want to spend heaps of time on STI website. They just want to get on there, get the info and get off. So the information has to be relevant. I've already mentioned it. And however, a few of the rangatahi said that it would be good to have a further information button to click. So you click on that, it takes you to another page that's a bit more comprehensive explanation of the whole process. And another good suggestion we got was if you say there's a treatment heading, a local services, or where to go, sorry. If you think you've got STI, where to go. No use just saying family planning clinic. It's best to be regional specific. So if we're in Hamilton, if I logged on in Hamilton, it would be good to have under the where to go banner, okay, you can go to the new sexual health clinic by the hospital that Jane Morgan and them run. Family planning in Hamilton, the address and phone number for another provider in Tokoroa maybe, or over Coromandel. So it needs to be region specific, the information, not just family planning, because that means they've got to go find that address, find that website, if you get what I mean. So some benefits to collaboration. You can draw on, if you're collaborating with other groups, you can draw on their networks and expertise, especially if you're trying to reach a hard to reach audience. And all of us are running on shoestring budgets, so if we can work together and draw on each other's expertise and resources, then it makes our jobs a whole lot easier. I think that's one of the, that is one of the great reasons of having things like Posh, Waikato, Wish, Shag down the deep south, those sort of networks of sexual health promoters, because we get to see what they're doing, tell them what we're up to, see how we can work together. And that maybe that's something you might, I don't know if there's something like that up north, but that's a way to get to know who's in the sector in your region. So just, youth preferences for website, and probably argue for resources. They want short and sharp info, no jibber jabber. Audio visual material instead of plain text. They suggested having celebrities on video giving out messages, so like it might be someone like Lord saying, oh, hey, go get checked up, and go get checked up here, or some rugby or league stars like Sonny Bull Waiti, people like that who can get the message across, people that they look up to, instead of reading it off the screen. And of course the information has to be youth relevant, use their language, and important to have localised information where they can get tested. So just to conclude, big thanks to all the rangatahi that came into our focus groups, took time away from hopefully not school, and then our health promoters who took time away from their mahi, busy day-to-day mahi, but they were still willing to come and help us out and share their thoughts. And of course to our 2 youth providers, we just couldn't have done it without them. They provided the networks and the resources just to get, we would have been buggered without them actually. And of course STI for agreeing to have us come on board and collaborate on the project. But that's me. Kia ora.